Between my sister, my parents, and myself, our family has had a total of 9 knee replacements. Yes. My sister, Sandy, has had 3 total knee replacements herself. And I've had 1 total knee replacement. And add to that factor being a woman of a particular age, a plus size woman, and a Black woman. Well, this experience with total knee replacement, let's just say it was a little different. And that's the part that they don't tell you. So we're going to talk about it today. Welcome, friends. Oh, thank you for joining us for a very special edition of Coffee and Conversation. You know, that's my interview segment over here on KendyK all day. And friends, I am super excited to welcome back somebody that we already know. It's Sandy, the owner and proprietor of Pound Cake Experts. Welcome in, Sandy.
Thank you, KendyK.
Thank you, Sandy. Well, Sandy, friends, is my real life sister. And y'all, let me just say this. If you don't have, I call her Sue. So if you don't have yourself a Sue, you better get you one. So she is my sister, and she is 1 year older than me. And you know, KendyK is 50 and fabulous. But KendyK has also had a total knee replacement. Sandy, let's get right into it. 3 total knee replacements. Share with us, please.
Well, KendyK, thank you so much, first of all, for having me on your show. I am just elated to be here with you, talking about something that's very near and dear to me because it's a process that I've had to go through, like you said, not 1 time, not 2 times, but 3 times. So I had knee replacement because I just noticed there was like pain, and kind of as I was getting older, there was more pain. I would see doctors. There was, said it was arthritis, and eventually just bone on bone. I also would say because my weight, I was really on the heavier side for most of my life growing up. So that does take a toll on your knees and on your joints. And so because of that reason, I was bone on both knees, my left knee and also my right knee. Um, Pushed through those surgeries, did extremely well
Yes, you did.
until all of a sudden, one knee just kind of seemed to be regressing a bit, and I started experiencing pain. So went to the doctor, found out that I needed to have a total knee replacement again.
Mm.
Again. And I was shocked by that. Normally, the orthopedic doctors tell you that knee replacements last, 10 years, 15 years. And it had only been a few years for me. So you could just imagine it just hit me kind of like a ton of bricks. I was just shocked. I'm a baker, right? Everyone knows I am Chef San. I am a baker, and I'm known for 50 flavors of pound cake. So baking is what I do. And I must be on my feet, a lot. We're mixing, we're baking, we're taking things out the oven, we're putting things in the oven, we're
Yeah.
cutting, we're packaging, we're doing all of that on 2 feet all day long.
Mm-hmm.
So you're pushing through the pain, you're pushing through the soreness, the arthur, back where I come from, we call arthritis arthur.
Yes, yes.
So
And you
arthur,
know, our daddy, Papa, he had rheumatoid
yes.
arthritis, such, and his doctors all said that his was one of the worst cases they had ever seen. And so Papa, my daddy, before his death, he had 2 total knee replacements, and then he had one of the knee replacements had to be repeated
Uh-huh, uh-huh.
because we're talking about a man who did labor as a cement mason on his knees, spreading cement. I'm talking about when they hand finished cement
Right.
um, on his knees. That is how he made a living for us as children. And my dad was disabled from working
Yes.
because of those knees. Because of, he went to the doctor, and the doctor said, we are going to do the paperwork and fill out so that you can file for permanent disability. And he was disabled at that time. And so before his death, he had a total of three knee replacements, and they did one leg twice. Same for you, Sandy. Sandy, when you stop and think about it, our mom had two total knee replacements.
Yeah.
I have had one, and I don't want to cross that bridge again.
Yeah.
What do doctors, what do orthopedic surgeons say to you, Sandy, when they hear how many knee replacements we've had just in our immediate family? And that's notwithstanding the aunties, the uncles
Yeah.
on both sides. There, what do you tell your orthopedic surgeons, and what is their response, Sandy?
Well, KendyK, and shout out to Simply Debbie Sue. Thank you for joining. Peaches, thank you all for joining. Come on in. Go ahead. Don't be ashamed to send us some chats. Let's shout out everyone. So you know what? Some doctors are intrigued by it because I am so young. You know, we're just in our 50s, but we're still considered young for having total knee replacements. And um we come from a long line of knee replacements, like you mentioned, mom, dad, aunts, uncles. Like a lot of people in our family, especially our immediate family, have had to have knee replacements. And so doctors, they're just like, you know what? You're young, you're strong, you should be able to bounce back pretty fast from this. The recovery period for me. So for example, if if you're older, like 60, 65 years old, it takes them a lot longer to get back on their feet, get pushing again. Even at the hospital these days, they're getting you up, you're having your surgery in the morning, they're getting you up on your feet later that evening and walking. A
Of
lot
day
of older
one.
people of day one, a lot of people the same day are just walking like a few steps. Well, when I had my first, second, and third knee replacements, I was out walking the hall fast.
Yes.
Yeah. And so that is attributed to just my youth
Yes.
and staying healthy. Those are some things that you really kind of need to know about. But with aging parents and aging grandparents, you all might be responsible for taking care of those people. I know we helped to take care of our mom and our dad when they had their knee replacements. So this is really great that we're having this conversation, and hopefully it's really timely for someone who might be going through exactly what we've actually experienced ourselves.
Yeah, after 9 knee replacements just in our immediate family, 3 for you, Sandy, 1 for me, and I'm told that I have moderate arthritis on the right side. My total knee replacement is on the left side, and now I call my total knee replacement my good knee, my good knee.
Exactly.
And so, Sandy, do you remember Mama's? I think it was her second knee replacement. And
Mhm.
she had it at the orthopedic hospital there in the Midwest.
I do.
And you remember that? And they had her hospital stays were a week apiece, full week in the hospital. So that is really different how surgeries have changed. And I think medicine in general has changed. And they recognize the longer you stay in that hospital, the higher the risk of infection. So they
Right.
try to get you in and move you out. But she was a part of what at the time of her knee replacements was cutting edge technology. They took all the patients in on a Monday, did everybody's total knee replacements, and started rehab that same afternoon and every day for a week
Right.
in what they called joint camp. Do you remember joint camp with
I
Mama?
do. Yes.
Yes. Tell
Mhm.
us some of the things that a person could expect from joint camp. And we have a couple of questions. So let's take those, and then we're going to talk to you more about joint camp and what to expect. And this is a timely question coming in from the low carb queen. Welcome in, low carb queen. She asked, how long was the recovery for your parents? So
Ooh.
you were with Mama the surgery week. I flew in for the second week once she got back home. Go ahead.
So if I'm remembering correctly, I would say our mom was off of work for probably 3 to 4 weeks, maybe. Certainly a
I
longer
think it was longer
period.
than that.
You
Yeah.
think so? I'll have to remember to ask her, but I remember it was a solid month. But again, those types of recovery numbers I think have changed. And yeah, Gemini Diva, it's crazy, it's scary. But you know what? If you need it, you need it. And when the doctor tells you that this is an option for you, I can totally stand behind and cheer you on and say go for it,
Yeah.
because it really did change my life. Like walking on bone and trying to exercise bone on bone is ridiculous behavior.
Yeah. I
So
second
for
that, Sandy. The only thing I regret about my total knee replacement is waiting so long to have it.
yeah, and uh uh EB Carter commented that some people go home the same day. That is so true. I can tell you my first knee replacement and my second knee replacement, I stayed one night at the hospital. And do
Same.
you know, yeah, same for KendyK. Do you know, KendyK, that on my third surgery, when I tell you they had me running the hallways like they were blown away. So hours after I had my knee research surgery, knee replacement, I went home and got in my own bed and walked to my own bathroom. Like literally same day I was home.
Because we like our things. Like we like our home space. And to me, it wasn't until you got home. So let me tell you how I ended up at home the next day,
Mhm,
because the doctor, my surgeon, I used the same surgeon that Sandy did for surgeries 1 and 2. And
mhm,
because she had talked about such a positive experience with her orthopedic surgery, I did something that I had to do, because if you recall, saying I was living in Chattanooga by myself at the
mhm.
time.
Right.
And I knew what the recovery had been like, because I had helped you to recoup at home after surgery. And you absolutely need a support system in place to recover after total knee replacement. We want to shout out Mrs. G, your favorite auntie. Thank
Mhm.
you for being a member of
I
KendyK's crew
agree.
for 3 months. Mrs. G, you've got to meet my sister Sandy. We call her San for short. So yeah, I was in Chattanooga, and I knew that I was going to need support. So I made a phone call to my son. I said, "Sir, I'm gonna have this knee surgery, and I've been thinking about it, and I think I need to come to be with you in Texas, and just let your doctor do it." And y'all, my son, she wasn't quiet, not even 5 seconds. She said, "Okay." And my son took me in. My son took me into her home, had my room ready. Well, she always has my room ready. Had my room ready. And y'all, I went probably, I think it ended up being like maybe 3 full months before I even had surgery. They, because I was at a distance, it took a lot of coordination with the orthopedic surgeons to agree to take me on as a patient, using the records of other doctors and their x-rays and stuff. And I was flying back and forth. And then I just, they were like, well, we're not going to take you. It was clear they were not, the orthopedic surgeon was not going to take me seriously about doing this surgery until I showed up in his office, right? He
Yeah.
looked at my records a little bit, but clearly, right? And so, and I needed this because I needed to put him in my vacation time and medical leave, all those things. So I kind of shut down things and a little bit, and then came on to Texas. And my sister, she had made all of these provisions, and she had set me up at the community center, and they had a great state of the art brand new facility where they had warm water therapy. Oh my gosh, it was just the best place for me, because I went 2 if not 3 times a week prior to surgery to do that underwater aerobics in that warm water. And so, you know, so easy on my joints,
Yeah.
and because the doctor said to me, KendyK, you you're not a good candidate, basically. Did you get that conversation? I know people see you now, but you were obese for surgeries 1 and 2.
Yeah. You're right. Hi Cal. Thank you for joining us. Um, yeah, so again, with most surgeries, ideally, you want to be at, optimal health, so that includes things like your blood pressure. They're going to run a bunch of labs, they're going to check your weight. So if you're overweight, which I've been most of my life, um again, that's going to make a surgery harder, and there's a higher risk for complications. I feel like I could have been a doctor like in my previous life, y'all.
Hey,
There could have been, more complications. The more risk factors that you add to the equation. So if you can lessen those, and if you can get at a healthier weight, then likely your surgery outcome and just the process of going through surgery, being put to sleep, going through anesthesia,
yeah,
coming out of it, it's going to be better and easier for you all the way around. And your doctor, your surgeon, they're all about being successful with your surgery as well.
yeah.
Like,
They don't want you
nobody
messing up their stats, right?
don't mess up their stats. And they care about you too. Like they don't want to lose someone to, being on the table.
Yeah.
So yeah, those are really great points. Yep.
And it's also it's not just the excess weight and the risk for surgery, but it's the comorbidities, like you said, Sand, that come right along with it. It's the blood pressure, it's the anesthesia that is required, it is diabetes. And thank goodness that was probably the only thing we didn't have was type 2 diabetes, but our father had type 2 diabetes.
And
And
all of his siblings, like it really does run deep in our line, in our history, in our
yeah.
family.
Yes. We have so many friends. Why don't we give you a moment, Sandy, to catch your breath? And I'm going to scroll through so that you can see some of your friends and mine who are joining us for this great live stream today. We're talking everything you need to know about total knee replacements, especially when you show up in the world in our beautiful shades. Y'all, we are known for our smiles. What do y'all think? What do y'all think? Yes, and yes, to Sandy, if you're leaned in, y'all, Sandy is in fact drinking and eating pound cake experts. Oh, I'm drinking too. What are you hydrating on, Sandy?
I'm doing water. I need to have my cute mug like you have. I may just run and get it, but I'm enjoying some cake. My pound cake experts,
What
we're
kind of
known for
cake?
this flavor. This is our sexy strawberry. It's made with real strawberries. That's right. The high vibe, you know it. I'm eating cake, baby. And you know what? So right now, KendyK, I weigh around 115 pounds. And so actually for my height, that's really exactly where I should be, and that's where I try to maintain. KendyK has always been taller than me. So I'm 4'11". But this is really the first time in my
Yeah,
life
I'm
ever.
5'4.5" ish. I used to be 5'5", but I've shrunk and after surgery, and we'll talk about that.
We will talk about that. Yeah. And so now, it just having the surgery and being at a better weight, I can exercise easier. I can do house chores easier. I can bake easier. Like it really has made everything easier. The knee replacements and losing the weight.
Sandy, you are making great points. We've got so many friends. So my apologies if I have missed anyone who is coming in here. Mrs. G says you're a pint-sized lady. Friends, it is my sub has we grew up as those beautiful girls with those smiles, but we were fluffy girls, right?
Oh yeah.
And so to see my sister at what's your current weight range
I'm at 115 pounds. 115.
Wow, that I've never seen you that small. I don't recall you ever in life being that
I'm telling you, it's the first time I've been at go weight in my life.
well, honey, you are looking 51. No, are you 51?
51.
Yeah, 51 and fabulous. I had to think now, are we saying your children? Almost.
Almost.
So, do you remember that? Because I don't know that we look alike. Y'all drop in the chat. Let us know. Do you think we look alike? I don't think we look alike any longer, but y'all let us know. But do you remember growing up and folks would always ask in the grocery store, wherever we were, because we always had on fabulous clothes that our mom sewed for us on her sewing machine. And they were like, oh my goodness, are you guys twins? Y'all, we were asked so much, like literally every day. We would just say, yes, in the same voice.
Yes. We always sounded alike. We always looked alike. We always smiled all the time.
All the time. Those smiling girls, even at church.
Oh, Annette says we absolutely look alike. Hey, Annette, that's my sorority sister. She's my
Hey,
line
soror,
sister.
how are you? My soror, too. We want to shout out to those devastating divas of Delta Sigma Theta Sorority Incorporated. Happy Founders Day, soror.
Yes. And
Everyone
by the
said,
way, speaking of that, we just celebrated our 30-year anniversary with my line sisters. Had an amazing time here. They all flew down to Dallas, Frisco, and man, did we have a good time.
oh my goodness. And I'm looking forward to my 30th Deltaversary this spring. And y'all, my son flew across the country and pinned me another special moment that I will never, ever, ever forget. Thank you so. Anyway, we're talking everything about total knee replacements. Okay, let's get back. Let's get back. We're talking everything we need to know about total knee replacements. If you do have specific questions, please go ahead and drop those in the chat because we want to arm you with information about total knee replacements because there is so much to know. Friends, it's like this. Total knee replacement is the most common joint replacement surgery, elective surgery performed in the United States. And this is according to the American Academy of Orthopedic Surgeons. Can you believe that? It's not hip replacements. It's not rotator cuffs. And Sandy has had a couple of rotator cuff surgeries as well, but it's the total knee replacement. So y'all drop in the chat. Let me know if you know someone or if you yourself has had a total knee replacement. And yes, some of our sorors are saying, yes, we had an amazing time. I bet you did 30 years. That anything you've done for 30 years, that's you can put a pin there because that marks you're moving to a different level. Yeah, absolutely.
And similar to my real sister, with your line sisters, you truly have a bond and a connection that you will have for a lifetime. And we thank God for it. We thank God for it.
Yes, and we've got a trip coming up in this spring and can't wait for that. Super excited about that. Everyone is talking and asking, and y'all, please, if you did have questions about total knee replacement, would you do me a favor and drop those one more time so that I can ask Sandy and she and I can share. So the reason why my surgery was going to be like this, it was supposed to be go home from the hospital on the morning of the third day, and the surgeon was real clear with me saying, KendyK, if you cannot go home, if you're not ambulatory, meaning walking and moving good, then I'm sending you straight to the rehab center because you are too young not to get up from this surgery and be in a good place. So I was like, okay, well, I got to work hard. And I remember when they got
you did.
Huh?
You did work hard too.
Oh, thank you, sir. And when I did get home, when I did get up right after surgery, you're going to get up out of that bed on day one. They are going to get you up, and what got me up is I had to go to the bathroom, and so they got me up, and they were like, "Oh, we're walking to the bathroom," and I'm like, "Oh man!" And y'all, when I got to that restroom, and sat down. Do you know I bawled like a baby because it was
Painful.
so much pain
Painful.
and huh?
Painful.
Painful now because you just got cut. Now you just got cut. I remember the pain block, and I remember that saying you pre-surgery we're in the pre-op space, and surgeon comes in with his assistant, and they came to do the markings on the leg, and I was a nervous wreck, and Sam's just cracking all kinds of jokes, laughing, smiling. Everybody's connecting with her because she's now had 2 surgeries from this same orthopedic surgeon. The whole hospital knew her. And, because they do them all on one specific floor and all of that. And so then the surgeon is like, okay, I'm done with my markings. He's like, do you want to take a look? And I was scared to even look at the markings. And I looked down, and it was a happy face because he just simply needed to mark the leg that they were going to put the knee replacement in. And that made me laugh. Yeah. And that made me laugh. So I laughed, and then came the pain block. Now, Masua had shared a whole lot of background information, but she did not tell me what applying that pain block was going to be like. I mean, I hollered when they stuck that needle in my knee. And it lasts for.
Did they look at the needle?
I don't know because it was like, and I said for my mama. See, I went down, and because originally they're supposed to do my surgery right before the turn of the year. And then something happened, or he was going to be whatever. Surgery got pushed until a new year. And I was mad because number one, I would have got that surgery for free, right? No out of pocket for me. But when they pushed it, then when I was starting over a new benefit year, and I had not reached my out of pocket max. But anyway, I digress. But so all those things that as you're working through insurance and approvals, I was ready for surgery. I mean, I had to shed weight. The doctor told me, oh, I won't even do your surgery until you shed some of this excess weight. And I shed right at 40 pounds.
You did really good. I remember
right at 40 pounds because that's all I did. I was working by day and then would take breaks and get down there to that warm water pool and do those aerobics with those fabulous women and men, most of them twice my age, having total knee replacements, hip replacements.
Oh, yeah.
Things. And KendyK was right in that water with them and all of that. Sandy, would you do it again? 3 knee replacements.
Mm-hmm. So, KendyK, if you're asking me if I would have a 4th knee replacement, heck yeah. I am not scared of surgery. I'm not scared to be put asleep. You already mentioned that I tore my rotator cuff. Not only did I tear it, I tore it twice. And so I had to have rotator cuff repairs twice. Which was crazy. Honestly, even though knee surgery is painful, rotator cuff recovery was much more painful than that. I would do it again. And that's why I can, really boldly encourage people. If you feel like you're having a lot of knee trouble, it's not something that you have to suffer through. Oh, thank you, EB. It's not something that you have to suffer through. Go ahead and get the knee replacement. If you have the surgery, and you have the insurance, I would encourage you, when it comes to insurance, if I ever had to have any type of surgery, procedure, anything like that, I like doing it at the very beginning of the year. Because then usually you're going to meet your deductible. Usually you're going to meet your out of pocket, amounts. Usually that's the case. And if that is the case, then you are set for the rest of the year. Like no more paying for prescriptions. Like usually your insurance is going to be meeting 100% of your coverage for your benefits. So that's always nice. Mm-hmm. So yeah, I
ended up paying $1,000 out of pocket. And I tried to tell them, hey, they did an MRI. they did something else on me. I ended up having to have another medical insurance that had already, I paid for that because of the beginning of a benefit year. And so but it didn't go through the system. And so they ended up still giving me that back. And I think it was for anesthesia or something like that, for the anesthesiologist bill or something. But I got it back. But yeah, but you're right. I tried to do everything after that. The knee replacement. Well, I hit my out-of-pocket max at the beginning of a year dealing with all the knee stuff. And then so I tried to do anything else medical. I was like, yep, let's do it. Because I knew I had no other things else to pay as far as deductibles and all of those things. Y'all, you kind of want to carefully coordinate that stuff.
Absolutely.
Yeah. Including inviting and flying your mommy in for the surgery. So once I had my village in place, my Sue was going to take care of me. Then, because my Sue had at that time 2 total knee replacements already, she knew the things that we would need in the house to make sure that I could be on my way on the road to recovery once surgery was accomplished. Can you talk about some of the things that we purchased so that we could kind of retrofit my bedroom at your house and bathroom?
Yeah, of course. I would encourage you to get some snacks. So I'm eating I'm eating some cake by Pound Cake Experts, and now I'm eating a cookie by Pound Cake Experts. Look.
Okay. She cutting up, y'all. She cutting up. Okay, so let me do this. Let me do this. This episode of Coffee and Conversations is being brought to you by PoundCakeExperts.com with 50 gourmet flavors of pound cake shipped to you from all over the country, featuring vegan, sugar-free, and gluten-free options. It's Pound Cake Experts on all social media. I can't do nothing with her. I can't do nothing with her. Go ahead.
Okay, so KendyK, you really bring up. Thank you for showing the love to Pound Cake Experts. We gladly support your network. So you asked what were some of the things that kind of make life better during a knee replacement procedure?
Ooh, yes.
So let me show this. So these actually are made by our mom. These are called walker bags. So I'm trying to make sure that you guys can see them.
I see that Texas orange. We see that Texas orange.
That Texas Longhorns. We got the OU Sooners. We got those Cowboys. We got lots of different fabrics that you can choose from. She actually can custom make those. They're only $40. But listen, if you get a walker bag for someone that you love that's going through knee replacement, you will be their best friend in the whole wide world, and it means that you really love them. Because, and let me just show you. I'm just going to take one.
Take your time. Show us that walker bag and go ahead and take it off so you can show us, or however you want to do that. Because not only do you need a walker bag, you're going to need a walker. That's going to be needed to coordinate with insurance. But check with your church members, check in your immediate family and in your social groups, your coworkers. Somebody probably already has that. So if your finances are limited or your insurance may not always cover some of those things, you can get one. You can rent those types of things like a walker, and walkers come in different sizes. So I had shed enough weight that I was able to use just the average size walker. But if you are super morbidly obese, then you want to make sure that they order you the heavier walker that can hold your body weight. And so, because it is so important, because that is your best friend, that walker is your best friend. Go ahead, show us the walker bags.
So this is a walker bag. You cannot find these in a store. You're not going to go to Walmart, Target, or any of those big box places and get a walker bag. These are custom made by our mother. She is Gertrude of G&D Crafts, and she literally makes all of these. You can see I've got huge stack here of walker bags. Because you can literally, she can make any, like some people like sports teams, some people like a floral design. Just depending on who the patient is, will determine what kind of walker bag. We sold so many of these. These are the perfect gift. Let me show you, KendyK, how amazing these walker bags are. So they've got roomy pockets. When I say roomy, look at that. KendyK, can you see that?
Yes.
Look at these big, deep pockets. And
I
not
had to
only
put
that,
everything in that. That allowed me to, when I got to a point, to be able to take my shower on my own because I could put my things in there.
yeah.
Eventually I was able to drive myself to physical therapy. And so I would just put everything in there.
I
Everything in
mean, you
those
can put water
pockets.
bottles in here. You
The
can put
wallet in
stuff in
there,
here. You put
everything.
the
Yes.
Yes, and they go so well. You can use them in the house. You can use them outside. You can use them at the store. But not only they go on walker bags, you can use them on rollators. You can use them on wagons, wheelchairs. We had an amazing customer buy one for her wheelchair. She was a real jazzy kind of customer, and honey, she couldn't do. She had no use of her legs, but she spun herself around and was so glad to hang
Aww.
bag on. It was just really, really so special. So something like this. Oh, KendyK. Not only are they super amazing, just for daily use, they literally can be put in the washer and the dryer.
I'm sold
Washer and
because
dryer.
yes, I am all OCD about cleanliness of things. So yeah, I love that you're able to wash them. Yeah, she's got African print. What's on that one,
So this
Sandy?
is gonna be like if you got someone who loves football, that's what this one is gonna be. It's got again the nice roomy pockets, two big ones in the front, and then a huge one with a zipper on the back. We got Texas A&M, Alabama, Steelers, Cowboys. The list goes on and on. We even have military or firefighters. In case
Yeah,
someone's a vet or just needing something like that. Fire department. If you love cats, we can get you
cat
fabric with
mom.
cats.
Yeah.
Yeah. So
Now, let me say this. Let me say this. As we're talking about everything you need to know about total knee replacements, especially the recovery process, let me just say this. We are not medical professionals, so it's always important for you to coordinate care with your medical provider. Talk about any specific questions that you have. This is just being brought to you, just sharing our stories with you so that you will better understand what the full process is. Sandy, do you feel like the surgery or the recovery, including physical therapy, which one is more intense? What's the biggest part of total knee replacement?
I would say the surgery itself is not that intense. You're asleep, right?
Yeah.
So I would say the recovery is the part that you're gonna have to really deal with. But like you mentioned, a great support system is mandatory. You have to have some people that can surround you, that love you, that's going to cheer you on through the harder days, through your physical therapy. And physical therapy, it doesn't stop with you just going to your PT
Right.
every 2 or 3 times a week. You got to do your exercises at home too,
Mm-hmm.
every single day. And
Did
I
you sell
still
my recumbent bike? I even purchased a recumbent bike from Walmart to make it affordable. And they will put those recumbent bikes, those exercise bikes, any of that exercise equipment like that, just like a regular bicycle or 10-speed bike. They will put that together for you free of charge. But I purchased a recumbent bike, and it really made the difference in me continuing to be able to work at home outside of my visits to the therapist 2 or 3 times a week.
You
Sandy,
were so diligent with your recumbent bike. I never had the recumbent bike, but if I ever had to do it again, I would get it because you were so diligent with it, and I could see how it really did help you. You know that motion, that range, it helps with your range of motion. I can tell you, like right now, I can still bend pretty good.
mm-hmm.
Um, but the more you exercise and the more range of motion that you have and you keep, and that you gain back, the better you're gonna be.
Yes.
If someone wants to see my knee replacement, um, you can just let us know in the chat. I'd love to show you my new knees.
Well, they've got to chat it up, and if we
Hey,
get
got
enough
a
chat,
chat.
she will share her surgery scar with us. And friends,
You
so
even
I
Carter,
want to
that's
make sure
right.
folks are getting some of their questions and their needs answered. So
Oh,
we
got some
know
super
you're
stands out
going to
there.
need a walker. You're going to need a walker,
Yeah.
and we suggest even a walker bag. And I know for the bathroom, I just purchased everything because Sandy had these things, or she had told me these are the things she wished she had. And one of the things that we purchased was the toilet riser.
Yeah.
It
Oh,
kind of
goodness.
just sits on top of the commode on the toilet, and it gives you about, I don't know, about that much more lift on that toilet.
Yeah.
And oh my gosh, I wouldn't have made it without that, because when you sit on a toilet, you've got to do probably a little bit greater than a 90-degree bend of your knees.
Yeah.
And after total knee replacement, your knee does not know how to bend. It comes in a box straight out, right?
Right.
And we had these bionic knees that were fitted. They did an MRI of our knees, and it was made especially for our bodies, right? They were custom.
Yeah.
They weren't just drop-ins. They were custom to fit our bodies based off of the MRI. And y'all, if you take something that is just like this, you have to teach it to bend. And you know how many times you go to the bathroom, y'all, and you're talking about pain, okay? But there is going to be pain after surgery, and pain control is so important. So having that and thank you, Sil, for sharing that I needed to get that toilet riser. And then I remember the bench. I remember the shower bench where it half of it was, 2 of the legs were in the tub. And then because my sister in her master bedroom, she of course has a walk-in shower, but I didn't want to be kind of infringing upon her shower space and her master suite in her home, because I had a bathroom right across from my bedroom. So half of 2 of those seats to the shower bench sat over in the tub, and then the other 2 other 2 legs sat on the floor of the bathroom. And you could just sit on that bench and slide your bottom over,
Right.
pull your legs over, and it just makes it so safe. And y'all, that was like $50. $50 to ensure that I did not have a fall. The physical therapist came out to the house. Actually, it was occupational therapy, came out to the house to ensure that I had all the things that I needed. And then they kind of do an assessment of trying to help you get back up on your feet, seeing what your needs are going to be. And they were super impressed with everything we had, until we said, well, Sandy has already had 2 total knee replacements. People just absolutely find it unbelievable that you at 51 have had 3 total knee replacements. Is there anything else you can think of, Sandy, that folks would really need to be ready for the total knee replacement?
Well, let me give a shout out to Family Journey. Thank you for joining. And also,
yes.
Listen, Carter, EB made an amazing comment that we should definitely
Okay,
say.
let me find it.
She
Go
said
ahead.
that it makes it medically qualified item for the FSA and your HSA. So if you have FSA funds, HSA funds that you need to use, look, things like a walker, like the walker itself, that's going to qualify. That usually will qualify to be used with your FSA, HSA funds. Things like a toilet riser, things like that are usually going to qualify. So make sure you do a deep dive into what qualifies to be able to use and spend your FSA funds, and know when those are going to expire, because some companies you have to use your FSA funds by 12/31 of that year, by like 11/59, but sometimes they carry over.
Till
Just
March.
depends on your company. So ask your HR department if you have questions about your specific plans.
And check too, because a lot of times now the FSA funds, especially, you can, or an HSA funds will have your Visa logo or MasterCard logo, and you have a little card, and you can actually use that little card as long as the items are labeled accordingly as FSA or HSA on Amazon. You can use your card to purchase those items directly from Amazon, and they tend to be some of the cheapest, as you know, as they're cheap for most things. And those are really good medical supplies. I think that's where I got all of my medical supplies that I needed, even down to the ice packs. Even down to the ice packs. You're going to need a lot of ice packs. So I ended up having a one night stay in the hospital, even though that was not the planned experience, because what happened, and I just thank God, all praises to God and his glory and his infinite wisdom. Y'all, I had total knee surgery one day, and the next day the world shut down for COVID. Literally, they shut the world down. And remember, everyone, my doctor came in for grand rounds. He was there exceptionally early, probably like 5:45, and he was like, KendyK, we're gonna go home. And I said, well, first of all, where's my mama and where's my son? Because they're supposed to be here. But I literally only had one, half an eye open because he was very early. And I now realize he was trying to be very calm about it. But he was like, okay, we're going to go home. And I said, what? And he was like, we're going to go home. He didn't tell me that they had shut the world down. And that
it came out of nowhere,
Yeah, it was COVID. And at the point, like they were shutting the world down, we did not even yet know that it was airborne. We did not know that it was
I know.
airborne. And
we didn't know what was to come. That's for sure.
We did not know what was to come. And he was like, I'm just going to send physical therapy to the house. And I said, all I can say, y'all, was, oh, okay. I'm like, what is going on here? And then by that evening, because I'm still now they're gonna push that pain meds and take it, friends. Keep your pain medicine and the schedule for pain so that you can manage your pain following surgery. Can you tell them a little bit about the baby aspirin routine? Sandy, do you remember that?
I don't think I took the baby aspirin.
Yes, you did.
I honestly don't remember that.
Okay, well, let me share a little bit. To minimize the risk of blood clots, right? They're going to put you on a regimen right before surgery with baby aspirin and I think it starts right before surgery, and then they continue that on to minimize the risk of blood clots, because you're going to be laying in the bed a lot. After they do physical therapy with you, you're going to be so exhausted. After you take a shower, after you bathe, you're going to be so exhausted that, and you need your meds. And y'all, there are going to be some heavy duty meds. So y'all lean into that and stay ahead of the pain. You want to stay ahead of the pain.
And take them. Don't think that, I'm going to get addicted to this pain medicine. No, baby, you won't get addicted, but you need to stay ahead of the pain, because when you're in pain, things like it makes you grouchy, it makes you irritable, it makes you really not want to do the things that you need to be doing. So it makes physical therapy that much harder. It makes doing your routine, therapy and exercises at home, it makes that harder. It makes so many things harder. So you want to stay ahead of the pain. Take your medicine. It's going to be stronger medicine. Again, we're not doctors. We're only just kind of going through our personal experiences. So that's what we're here to share. I can show you my knee. If you can see, this is my knee. And actually, this is the one that was done twice. I actually I had staples in mine,
Oh,
but they no longer
I
even do
didn't have
staples.
staples. I did not have staples.
Right
Mine's,
now,
I
they
had those
look
clear, white, invisible. They just dissolve. Wow.
exactly.
Wow.
Yeah, so I got the scars like my mom and my dad have. I don't know if you can see it that much, but I had staples in this bad boy. And they just, after 10 days, something like that, 12 days, they plucked those staples out. Now
Wow.
they just glued the
Yeah,
incision
they
closed.
just glue and stick them together, and
And
yeah,
it stays. Yeah.
it
So
stays.
technology is getting better and better with procedures. So your experience today is going to be even easier likely than our experience was some years ago. So
Yeah, Vicky's World says, yeah, when she stopped taking their payments, and it was not easy. And I remember having an issue one day when physical therapy came in. Of course, they always do an assessment, take blood pressure, because I was on blood pressure pills at the time. And so they would take my blood pressure before we started physical therapy. And then eventually, once they learned more about COVID, during the weeks of physical therapy. And I think I actually did 15 weeks of physical therapy following my total knee replacement. Um, and we want to welcome in a new member, Miss TT, Miss
hey,
Vlog,
Miss
has now
TT,
become a member of KendyK's crew. Welcome in, friend, and thank you
welcome.
for joining us. Yeah, so I did 15
Kyle is
weeks
still
of
with us too.
I'm sorry.
Kyle is still with us too.
Kyle is hashtag that guy. That guy. Kyle. We love Kyle. Kyle, they just had Kyle Vlog Day was on this past Tuesday in the YouTube streets. The whole day was Kyle Vlog Day. And he is one of our favorites. Hashtag
Yes.
Kyle Vlogs. Yeah, so yeah, I did have that one day where my blood pressure spiked through the roof. Because they're always tracking that, and you have a log and all of that. My blood pressure went through the roof. Do you remember we also, in addition to that blood pressure scare, went to the doctor? Matsu rushed me over there to my primary care doctor, Dr. Lou. Shout out to Dr. Lou. And Dr. Lou said, "What is going on?" And so I want to talk about this because I want folks to know. So I called the surgeon, of course, and said, "Hey, I'm in immense pain, and I'm out of pain medication. Do you know they declined to fill that prescription again? They declined to fill that prescription again." So I called my doctor, and my doctor, she said, "Come right on in." And she could not believe it. She was livid. In fact, she was livid, and I was loving it that she was livid. And she said, "Are you in pain?" And she said, "I already know you're in pain. I can look at you and tell you you're in pain." And she was like, "And I'm going to fill this prescription." And she did. She was
Yeah,
like, "How can you do physical therapy if you're in pain?
exactly.
Or with a blood pressure sky high?" And again, I have to, and I was already feeling a certain kind of way, but that confirmed. I'm like, I know you're trying to make sure because you're on some heavy, I guess it's like a tier 3 drugs for pain management. And these are narcotic level pain medicines, but and I'm allergic to morphine. I'm allergic to morphine. So, you know, I know that, but I also know that you can clearly see that I'm in pain. It's been confirmed by the physical therapist coming to the house. This is what her blood pressure is. I'm checking it every 15 minutes and it's going higher. And they wouldn't even do physical therapy on me because it just was not safe at those blood pressure levels because I was in pain and trying to still manage through the pain. Then we had another scare where we went right back over there to the ER because these were we called the orthopedic surgeon that day, and they said take her straight to the emergency stand, and thinking I had a blood clot. Thinking I had a blood clot. So you've got to be
You
careful about
cannot play around
those
with
things.
that.
And you don't play with a blood clot. When if you feel one part of your leg is on fire with warmth and the other part is ice cold, you go head straight to the ER and see what's going on. And they'll
Well, and
take you right on it.
thankfully, KendyK, it was not a blood clot.
Was not.
Because at that point, when you're talking about blood clot, that's another reason why you have to make sure if you see something is wrong or different or super painful, abnormally painful, you want to just get to the ER and let the doctors, the specialists see you.
Yeah.
And they do ultrasounds, they do all kinds of things to make sure that you don't have a blood clot. Because blood clots, they travel to your lungs, they can travel to your heart, travel to your head, like all kinds of problems. So it is a life-threatening
Yeah.
issue. So
Situation. Yes.
yeah, they don't play around with it, and you can't either. So yeah. Hey, thank you, Brenda. Thank you, Cal. We appreciate you as much. So yeah, so these are things that you should talk about with your doctor, and with your physical therapist. If you have someone that comes to the house, let them know, hey, it just seems like this pain is like more, it's worse than it was, or the medication just does not seem to be helping like it was. Any changes, let the doctors, the specialists, let them know, because they're there to help you. So
Yes. Yes.
right, Gemini, that's right.
Absolutely. We had another question here. Talking about pain medication and making sure that you're navigating that. Yeah, if you do have questions about total knee replacement or the things that we are describing,
Mhm.
remember that you're not going to be able to drive. It was probably like, I don't know, I did 15 weeks of physical therapy. It probably wasn't until week 10 because you can't drive while you're still taking those pain medicines. You
At
cannot
all.
drive. Absolutely no driving. And y'all, I remember when my son, y'all, she just felt sorry for me because I've never been a person to be cooped up in the house. And so she was like, well, come on, we're going to the store. Now, mind you, I couldn't because it was COVID now, the world's locked down. But y'all, we went to the store and like I had been, all I could do is take my meds, eat, and roll over to the other side, right? And remember, I had that machine in the bed. Like they put a machine on my bed on my leg after surgery. Immediately after surgery, they put a machine that plugs into the wall um, on me on the operating table. And it bent my knee every 20 minutes. And they
Yeah.
would start it off at like 15 degrees. And then every week we had to bump that thing up. So by the time I went to physical therapy in person, I was already at 90 degrees of a bend. And I think I topped out at like 130 degrees on my.
EB says it's called a CPM. That EB, she's a smart lady.
Yes.
Yeah.
Okay. So yeah, but blood clots should not be played with. The ice packs. We talked about ice packs. You're going to need lots of ice packs. And if you don't have ice packs, you can even use your frozen vegetables, work well too.
Now, KendyK, did you use the little? It looked like a little like a little mini cooler, and it sends the cold water through a little tube, and then it wraps around your knee. I only had that on my
Oh,
third. I only had that on my third.
no, that sounds lovely though.
It was lovely, and I learned about it from my neighbor, Mrs. Bev, next door.
Hey,
Um,
Miss Steph.
yeah, we love Miss Bev.
We love Miss Steph.
She had it, and I was like, oh wow! And so I actually got that device. I don't remember what it's called, but it looks like a little cooler, and it's got tubes that go into like a knee wrap. So your knee is wrapped around, so it's wrapped around there, and it shoots the ice cold water around your whole surgery knee, and it feels so good, and it's better than, and it's just easier than an ice pack. So
This is such good information that we're sharing, and I'm super excited that so many get to hear this information. Y'all drop in the comments. Let us know. Are you the person that is considering total knee replacement? Do you have friends and family members that might be having conversations with their orthopedic surgeon at this moment regarding total knee replacement? Are you going to be a part of someone's recovery team? Are you going to support a person? So tell us what your role is here, or are you just here for information? Whatever it is, drop in the comments and let us know. Vicky's World says, don't forget about that breathing thing where you got to breathe into that thing and make the little ball go up so you can keep your lungs clear. What is it called?
I don't know.
But y'all know what I'm talking about. It has the blue tube, and you got to go and make that
Well,
little ball go up so that you
it's
get
with
air.
the inhale. You inhale. That's
Yeah.
where you want to make sure that you're inhaling really deep
Yeah.
and keeping it for a long time.
Yeah.
Oh, it's called
Oh, is that the CPM?
something is called an incentive
Where
spiral.
are nurses at? If you are a nurse, if you are a nurse practitioner, y'all know what we're talking about. Drop that in. Incentives spirometer.
Incentive spirometer. And so the respiratory therapist usually will see you after a surgery like this. And so they are the ones that usually bring it in and teach you how to use it. It's something that you take home because you have to continue to use it a couple times throughout the day. Um,
Yes.
Something that I also wanted to bring up that Evie Carter brought up says after surgery, stay alert for respiratory infections, UTIs, skin infections, blood clots, constipation, and
Yes.
drug interactions or reactions. Listen, um, those
Jelly
pain
bean.
medicines,
Hey,
those
friend.
those pain medicines can stop you up. They really can.
Don't say that. Yes, they will.
They can get you constipated. So already have some things at home that you can use.
You're gonna need a big water pipe. Keep it
Lots of
clear.
water, right. Drink your Metamucils, up your fiber intake. All those things are gonna help because when you can't poop, it is not fun. So yeah,
Not
thank
fun.
you. Thank you for that, EB. Those are really great points.
And Vicky said it's just a little breathy thing. So if you remember nothing else about this extended conversations about total knee replacements, remember that KendyK and her sister said, see, it's Kendi and Sandy. Friends, KendyK said, oh, you got to be practicing your breathing. You've got to be doing your breathing things so you keep your lungs clear, y'all, because you're going to be doing a lot of lying down and in the bed. And because after they want, so when I went to physical therapy, they would use warm packs to loosen up my muscles or whatever for bending. So because we're about to get it in for an hour on all their machines and things. And shout out to the physical therapy team. You take a person who is basically not walking on their own, and after 10 to 15 weeks of physical therapy, they are back up and moving and grooving and resuming life. It was like a fresh start for me after physical therapy following total knee replacement. You've got the pain of surgery, but what you notice right away is that constant pain of bone on bone. I love your pound cake experts mug. See,
Yes, just go to poundcakeexperts.com. Poundcake Experts.
love that. Love that. Yeah. So yeah, just doing the physical therapy. Shout out to the physical therapy team, the physical therapist and the physical therapy assistants who keep you motivated, who give you the warm packs and then they ice you down. And one day, what I remember about physical therapy is that it was okay through the week, and then you have to get to the weekend, right? And you got to get through Saturday and Sunday, and sometimes a Friday, Saturday, Sunday. When you start back on the next week, and they have to break up all that scar tissue, it'll bring you to tears. And it did. And it did. Did you ever cry in physical therapy?
One time I wanted to fight. Yeah, I wanted to fight. I wanted to fight my physical therapist. I really did. It was it was crazy hard, crazy painful, and I was ready to fight.
Don't fight. Don't fight, sir. Don't fight, sir. Uh, yeah, it's intense. It's intense. But friends, I realized how they were just really working with me. They were so very patient with me, and they would just walk away, and they would put me on the table, and they said, "Yeah, you got to do those bridges. Like you got to. I have to get up on the table, put my hands over my head, bend that knee, bend both of them, and lift up like London bridges." Do you remember that?
Yes, like it was yesterday.
Did
I
that not
I
seem
thought they
like a
was
fat woman? What do
I
you
thought they was
mean?
crazy. I thought
I
they was
thought they were
crazy
crazy. But
for even
one thing
asking.
it taught me was that we are stronger. We are much stronger than we think. And
Yeah.
yeah, and they were like, okay, that's one. We need 19 more. And it was so funny. I ended up buying everybody in the office, the physical therapist, and all of their PT assistants. I bought everybody lunch on my last day because they were amazing. And y'all, I'm a bit much on most days, so I owe them that much. Um, we've got some folks here. I cried because I felt so useless. Oh yeah, we've all been there. You do feel useless. You do feel. There are days, y'all. It's a range of emotions. I don't know if it's all the pain medicine or what, but it's a range of emotion. But one thing
It
I
is.
did learn once I got off the heavy pain meds, take yourself a couple Tylenol. Before you get ready to go to physical therapy, then that stuff will be kicked in, and it'll take the edge off so that you can work hard on all the machines and things.
Yeah, EB says they fight back now. Gemini says no fighting the PT workers. Yeah, they're not there to hurt you. They're
Yeah.
genuinely there to help you. But man, look, I'm a lover, not a fighter. I am a
Yeah.
lover and not a fighter. But baby, when I tell you I was ready to fight, I was ready to fight.
It's intense, y'all. There's a range of emotions. It is intense. But y'all, you're going to need a village. Make sure you have a support network, or you might want to consider having your doctor prepare paperwork for you to be in a rehab facility, whatever is going to get you back up and moving. So for a time when we weren't sure what COVID was or how it was being transmitted, they did shut the world down. And then once they saw, I attended physical therapy in person, but they only allowed one patient in there at a time
Yeah.
because, again, they weren't sure how it was being transmitted and all of those things. And so it was quite a ride. I would absolutely do it again. I would not have hesitated and waited so long because I think you just do your body much more damage. Do you feel, let me ask you this. Do you feel like one of your legs is longer than the other following total knee replacement surgery?
Well, KendyK, that's an interesting question. I would say surgery 1 on my knee, no. Surgery 2 on my knee, no. Surgery 3 on my knee, I not only do I think it's longer, I know that it's longer. It looks longer. Like if I stretch my legs out, this one comes out just slightly longer. So I know that it's longer. I do feel like that's normal because remember, they're replacing you with, an artificial knee. And so that's not going to be like your normal natural bone and stuff. It's going to be, um, it's going to be plastic, like this, whatever type of plastic that they use.
Yeah.
So that's going in and it's connecting to your joints and your muscles and all of that. So you got this foreign object that's being placed in there. And it can be the exact same length. I've heard that it can be slightly shorter and I've heard that it can be slightly longer. So on the third one, yeah. How about you, KendyK?
Absolutely. To this day. And who confirmed, I was always thinking it, but who confirmed it for me was my chiropractor. And he was like, oh my goodness, right? So, one, I needed an adjustment really, really bad. And that also really helps following knee replacement and just for overall general health. If you've not started having chiropractic care, try that as a natural, non prescription medicine route. I think we take so many prescription drugs. And so that's a more homeopathic, natural way. Do you get chiropractic adjustments, San?
I used to. I don't any longer. It's kind of 6, 7 when it comes to do they help, do they not? Like 6, 7. I feel like at times it helped. If other times I'm like, I don't know. If you talk to any chiropractor, they would say it definitely helps. But sometimes if you talk to ortho doctors, they're like not really encouraging it so much. So,
Mhm.
talk to your doctor, see if they think it's going to be a benefit for you.
As a woman of a particular age, and we're now women of particular ages, I cannot believe that you are 51 and I am 50 and fabulous. I'm just all about whatever makes me feel better. I just want to feel better. Um, yeah, there is a discrepancy in the length of my limbs, and we just had a cousin who had total knee replacement right before Christmas, and she called me and she said, KendyK, let me ask you this. Do you feel like one of your legs is longer than the other? I said, it's not a feeling. I know for sure. And she said, she immediately noticed. She said, because my gait is off. I said, mine too. Mine too. So again, it's not an exact science. Some, like you said, you didn't feel it in surgeries 1 and 2, but in that third knee replacement. And every time I stop to think about that, Sandy has had 3 total knee replacements. When they first started doing knee replacements back when our father was still living, the lifespan on those knees was about 10 or 15 years. So they would make patients delay having a total knee replacement.
Right.
Now, the way that they put these systems in the legs, and they are, um, I think they 3D cut them and all of that so that they will specifically fit that patient's leg in that joint space. All of the things. I'm not a scientist either, so let me not go there. But let's talk about what it's like after you've had a total knee replacement. Let's talk airport talk for a second. Sandy,
Mm-hmm.
go ahead. Tell them what they're going to experience following total knee replacement for the rest of your life.
Okay, so I do like to travel. For any of you who love to travel, the highways, the byways, through the air, whatever on the road, if you're traveling via air, you want to know that you're likely going to be stopped if you go through your regular, what is it called, KendyK? When you're going through security, what's that?
TSA, TSA.
TSA. When you're going through TSA. So remember what they're putting in. It's gonna come up on the X-ray like as metal. Like you have metal on you. And really you don't have a weapon or anything like that. It's your new knee. All right. And so that's always gonna come up. So what you're gonna do now is you're not gonna go through the regular TSA line. That they just kind of scan your body. You're just walking through straight.
And
You're
are
gonna
you
have to go
pre-check?
through.
Are you pre-check, Sam?
I am pre-check, but
I am too.
but
But
it's
even
the
for
same.
pre-check.
It's the same, right? You're gonna go through one of 2 machines. You're gonna go through a regular X-ray machine that you just simply walk through, right? You're not lifting your hands or doing anything like that. Or you're gonna go through the special machine, which will now be required for you. You're gonna hold your hands like this.
Or they now have one like this.
I have
PDX,
seen that one.
Portland Airport has the one like this.
Okay, so you're either gonna hold your hands down or you're gonna hold your hands up. You're gonna put your feet on the little feet that's
On the feet.
displayed on the floor, and then they're gonna scan you that way. Because if you walk through just a regular metal detector, it's gonna beep off every single time, 100% of the time. If you go through 100 times, it's gonna beep 100 times. So go through now. All you have to do is say, "I've got knees." Once they hear I've got knees, I've got a hip, they
Just
already
point to
know.
it. All you gotta do is point to it, and they'll
They
be like,
already
"Okay,
know.
okay." They kind of stop the line. Okay, ma'am, come on over here.
Right. They already know
Get your
what
bag. Do
you
you
got
have a
going
bag?
on.
Get your bag. You over here.
Right. That's right. And then they're going to be, then that is not going to, it's going to show, it's not going to show your knee or anything like that, but it's going to give them the all clear as far as you not having like, whatever is causing the detector to go off in the regular machine, it's not going to go off the same. So,
Right, right. So, but that I don't see that ending anytime at all. It just is, and I even now because I'm a woman of a particular age, at 50 years old, and I travel a lot, long haul flights from Tennessee to back to the West Coast. So I always wear compression socks as well, y'all. If you've
compression
not
socks.
found the ministry called compression socks,
And
it
honestly,
really helps.
didn't we wear compression socks after surgery? I feel like we did.
Absolutely. Yes. Get
Yeah.
yourself some extra pairs of compression socks because you're going to need to wash them. You want to freshen them up.
The
And you
hospital
just
will
need
give you a pair to wear out of the
yeah.
hospital, but you want some more. And they come so snazzy, different colors and stuff now. You can easily order those, match them up with your outfits if you want to. And if you're flying in general, I know that I'm scheduled to go to Nigeria coming up here, and I plan to have my compression socks on
Yes.
both knees to
Mhm.
prevent blood clots or to lessen the chance for blood clots. And I used to do long flights as well when I worked overseas. Long flight. I'm talking about 15, 16-hour flights. So I would wear my compression socks, just as just to help lower my risk for blood clots. So
And something else you should do, wear your compression socks and get up and move, especially when you're on those long
get up
haul
and move.
flights. I'm
Right.
the one that uses the bathroom. I mean, I've got to be in a dire situation to use the bathroom on a plane. That's just me. But
Me
when
too.
when my seatmate gets up, I'm all the time going to get up with them, and while they're using the restroom or whatever, I'm going to stand up in the aisle and stretch my legs and walk up and down as much as I can. Just get that flowing, and until my legs get tired of the compression socks. And if you've got a long day of flying, your legs are going to get tired from the compression socks, and then I take them off, and I keep some regular white cotton socks. And when I get to put on my little cotton socks, that kind of, gives me new energy to finish my travel days. Those are just some tips that I use. Let's talk about dental care. Before and after surgery, because I don't know if you remember. Yes.
I just went to the dentist yesterday, day before yesterday, and
Okay.
had my 6 month cleaning. So I can tell you something real quick, a
Go
funny.
ahead. Go ahead, Sin.
This is a funny about the dentist. So we have a new hygienist, and I love my dentist. And so when she saw my teeth, she was like, "Wow!" She said, "Your teeth are amazing." I was like, "Really?" She was like, "Yes." Some people ask me, "Are my teeth real?" It's so funny because I never had braces. I never have done whitening, anything like
I
that.
had braces.
You did have braces. So at the dentist, your doctor, your surgeon, your orthopedic doctor will tell you to take an antibiotic to make and I don't so back in the day they used to say that you had to take it for life, but
Yeah,
I
for the
don't
rest
think
of your
it
life.
I
That's
don't
what
think
they used
it's
to
a
say.
huh?
Yeah, that is what they used to say. Like even when I had surgery right before COVID, it said for the rest of the life you're going to be
Take an
special
antibiotic
checks for TSA at the airport, and also take antibiotics
before you
for
get
every
it,
procedure, including cleanings. But
including
now I've asked so many doctors, and the orthopedic surgeon wants you to be on antibiotics,
yeah.
but doesn't want to write the script. So that doesn't make sense. So the guidance has changed.
It has
I've
changed.
talked to both my dentist, my um, endodontist, because we've been doing some heavy duty dental care
Did
things.
you say doo
I said heavy duty.
doo?
Y'all don't get us started laughing. We can't stop. Don't you stop? Don't you start laughing. So, stop it. Don't you start.
That's what you said,
Heavy
doo doo.
duty. heavy duty dental care. And yeah, it really, you've got to be careful because of the risk of infection, because
Absolutely.
after knee surgery now, because this is a foreign body being placed into your body, right?
Right.
And so if there's any infection in your body, or if you get exposed to anything, it's going straight to that foreign object, to that total knee replacement. It would be the same for a hip.
Yeah.
So you have
Straight to
got
the
to
joint.
have good dental care before and after for the rest of your life, so that you keep that risk of infection down. And for some strange reason, y'all, we always grown up. Well, when we 50 years ago, we used to go for a cleaning a year, but
Right.
nowadays you go twice a year, every 6 months. And y'all, I don't know what it was, because I was doing my regular dental care, but I ended up with an abscess on my tooth number one at the top.
Mm.
Do you remember?
Yeah.
Yeah, and y'all, they had to take that tooth out of my mouth because I was 2 days out from surgery. And I said, the devil is a lie. In surgery, and they were like, "Oh, well, we have to take that tooth out now." It wasn't like come back tomorrow. No, they said, "Well, we got to get that out now." And
Yeah.
literally, the dentist wanted to talk to the orthopedic doctor and see, if I take this tooth out now, are y'all still gonna let her do surgery? And y'all, I was a praying woman. I'm like, my mama had just arrived in Texas. These people at work is already looking at me crazy because I was supposed to be back from surgery last year and they haven't even done this. Y'all, it was some crazy times, but God saw fit that I would get that tooth extracted. I was
Very
put on some
creepy.
heavy duty antibiotics,
Yeah.
so that they could flush out any infection, because they did not want that. When you cut your body for surgery, that, you know, infection up here could go straight down to that new joint in the knee. So they were very worried about that, and as they should be. But it all worked well. It all worked. KendyK is back. I'm
Yes.
I
Amen.
exercise free of pain, and I can travel to Greece and Hawaii, and
Yes.
Hawaiian cruise for my 50th. It has certainly been amazing. Y'all, if you have any questions, drop those in the chat. Anything else? So Sandy gets her medical care, and just for clarifying purposes, you no longer use the protocol of getting antibiotics for your cleanings and
So I actually do.
oh
I actually do. So my last knee replacement was 3 years ago. Maybe 3 years ago. So I actually, so if I have to have a cleaning, sometimes no. But if I have to have like dental work done, like when I had to have a root canal,
yeah.
I took the antibiotic, and my doctor has no problems, even though what the doctor tell you to do now has changed a bit. She still is okay with me still, following the guidelines that I got, years ago.
Mm-hmm.
Because kind of better safer than sorry when
Mm-hmm.
it comes to a knee replacement, and with them going all the way down in your root.
Yeah, if you
Uh,
need an endodontist, then that might be when you need to go back to that, needing antibiotics for those type of
yeah.
dental procedures. If you're going to need a crown, or if you're going to do a root canal, or if they're going to do when they do the screw thing and put the, it's some, I've got a lot of about $10,000 to $20,000 worth of we got beautiful teeth, but my teeth are fragile.
Mine are not fragile. I got some heavy duty chompers.
Yeah. Her teeth are big. Mine's are little chiclets.
Yeah. We have big smiles, but I've got big teeth as well.
This has been delightful, and I hope that it's kind of helped anyone. If you do have any questions, drop them in the chat. Well, I'm saying that, Sandy, would you tell them a little bit about Tell them a little bit about Pound Cake Experts. I know you can talk about that, and I'm going to roll through because I know we had some questions earlier.
Yeah. So you are Pound Cake Experts. is the name of my bakery. And listen, when I say we are known for 50 flavors of pound cake, we are literally known. We've got butter, kicking coconut, sexy strawberry, Sakatumi baby, blue velvet, Texas orange, just to name a few. And they are the most amazing cakes that you've ever tasted. I would encourage you, buy yourself some, order yourself some. Just go to poundcakeexperts.com, poundcakeexperts.com, and we will ship pound cake straight to your door. We ship nationwide. It doesn't matter where you're located. You could be in New Jersey, you can be in California, you can be in Miami, you can be in Iowa. It doesn't matter. We will ship pound cakes straight to your door. And so make sure you check us out online. Also, all of our social media platforms. Please make sure you join us, follow us, tag us, comment, do all those things because it helps us to grow. And what we're trying to do is to compete with nothing but. They definitely are competitors, and we believe that we can do as well, if not better, than the butt people. So just go to poundcakeexperts.com. We're always creating new flavors. One of my favorite things to do is to create new flavors. We just created a hummingbird pound cake that's amazing. We just created pistachio pound cake. Like the list goes on and on. We never get tired of pound cake around here, and you shouldn't either.
I'm still stuck on the way you just had a snack, and you know I am on one meal a day. I am doing intermittent fasting, and she just has a piece of sexy strawberry cake. Let's end on this. Let's do a quick 5 to 7 minute deep dive on this issue here, which is really pressing for so many. They won't give low carb queen a total knee replacement because of weight. Did either of you have this experience? It absolutely was my experience. The orthopedic surgeon said no. And Sandy alluded to it. She said they don't want to mess up their stats. They don't, not on their watch as the surgeon. They don't want to be the one who's patient. When you are obese, morbidly obese, overweight, with it comes the comorbidities. Sandy, did you have that experience? Share that with us.
Yeah, no, I didn't. I was certainly obese at the time, definitely over 200 pounds, and still was able to have my surgeries without losing any weight. I know that's not everybody's experience because, like you said, every doctor and every surgeon is going to be different, and they may have different expectations. So if you do have to lose weight, know that you can do it, and know that first of all, you don't want your knee surgery to fail. Like you don't want the new instrument, the new knee that they put in. You don't want it to fail because you're too heavy and you can't do your exercises, you can't do your therapy, and you're in too much. Like all those things come with excess weight. So if you do need to lose weight, there's so many things out there now that work. Go talk to your doctor, find out, if you can get some medicines, there's shots, there's pills, there's all kinds of things that you can do. Hopefully obesity, in the near future, is no longer this thing that we just have to have. I believe obesity is a disease.
It
I don't,
is.
I don't think it's something that none of us want it, or try to achieve or anything like that. I think it's a disease, and your body's temperature and limits as far as what you eat, it's off, compared to like normal weighted people or average weighted people. And so now at 115, my desires for what I eat, it's different.
You
Because
still love them sweets. Y'all, it
I
was my
know.
son. It
Look,
was my son who
I'm
who
still
who
eating
taught
cake.
me how to go into a fine dining restaurant, and we're gonna start our meal with the dessert.
Yeah, I'm eating cake, but look,
We're gonna have dessert while they're fixing our entree.
I love a dessert. I love a dessert. I'm a
We do.
dessert baker. Give me desserts. Give me cookies. Give me pies. Give me cake. Give me Rice Krispies. Give me fudge brownies.
Hey,
Give
we
me
like Rice Krispies. We love Rice
give
Krispies,
me
y'all.
ice cream. Give it to me. Give it to me. Give it to me. Look.
But let's get serious for just a second. Thank you for talking so passionately about weight and being overweight and
And
and,
our
and
pound cake does
obesity
not
as a
cause
disease.
weight problems. Our pound cake is good for you. It does not cause problems with weight.
Okay. Did either of you have this experience? We both, I absolutely had that experience. And the orthopedic surgeon said that he would not take me as a patient until I lost shed weight. And so I visited Dr. Lou, and she was able, shout out to Dr. Lou for advocating and sitting down with me face to face in a chair and talking to me. And I told her what I needed to do, and she understood and put me on phentermine or phentermine as a the pill because that I know GLP-1s were not even available. I'm
They
talking
were available to us. They were available.
and there it is. And there it is. And there it is. Wow. I'm at a loss for words. So yeah, so that's what I use to shed the weight. But my sister, she would have me on a high protein, low carb, high fiber diet, baby. She had me on a high protein, low carb, and high fiber diet, and I appreciate you. So that was just a sincere act of genuine kindness to just, I was at her home before what 5-6 months, and y'all, it wasn't anything nice. One thing I knew for the sure is we can never live together as one grown woman per household. So,
Amen.
low carb queen, how you do it with your beautiful daughters, I would never know because baby, one grown lady per household. But I thank
Our
you.
mama taught us. Our mama taught us that every grown person needs their own house.
Every grown woman needs her own grown place.
That's right.
Amen. But yeah, we're talking about a serious issue is that yeah, you got to advocate for your own health care. And so it's important to ask for these things. And I don't think our orthopedic surgeon, we're not going to say his name, but I don't think for surgeries 1 and 2, who did my surgery, so that makes 3 surgeries that he did for us. I think with his slim build, like your genetics gave you a slim build, right? And therefore you don't understand
No, it's not even
what
some.
that means to tell me that you need and are requiring me to lose 50 pounds.
Like Oprah Winfrey said, they don't even think about it.
Yeah, and
They never had
you
to
be thinking
even
about
think.
it, not the way in which you just let that roll off your tongue. And I'm like, well, it'll be, I will be 50 by the time I lose, 50 pounds for a surgery, but because, I did have a caring doctor in my primary care doctor. And also I did employ a dietitian. That's where I learned about dietitian because y'all, most of these programs, think about it. Insurance is big business. They want us to be healthier. So they are willing to put out those costs uh, for weight loss programs. I was in some program that was free from my insurance where they sent me a scale, they sent me a pedometer to count my steps, and all that stuff was free of charge. And y'all, and that's where I started my love for ordering things off of Amazon because I would just order things and they would send them to the house. Sandy, give us your final words. And I want to thank you for taking your time out of your busy schedule to accommodate us so we could have some real conversations about total knee replacement and being a Black women and how we respond and how we interact in this, it's just different. Healthcare, we're not in healthcare and it's different but how we've been able to manage. And you've gotten 3 total knee replacements, y'all. It was my sister who taught me how to be savvy with these healthcare organizations. Now she know how to work an insurance plan.
Yeah, let me just EB asked a question. I just want
Okay.
to address that. Pound cake experts, do you have a high protein, low carb pound cake option? Absolutely. Not only do we have that, we have gluten-free pound cake options, we have sugar-free pound cake options, and we have vegan options. So yes, we can do it low protein. I've created some protein pound cakes that we're going to be rolling out this February, because as you've noticed, a lot of people are looking to increase their protein in their general daily diet. So we're gonna have high protein pound cake. It is here and it's gonna be available on in February. And I also want to say I actually practice to this day a high protein, low carb diet. That really is what keeps me and has gotten me to weigh just 115 pounds at 51 years old. Again, being at my goal weight for the very first time in my life. High protein, low carb, baby, is the way to go. And also, somebody loves lemon pound cake. We've got the best pound cake out there. We have lemon joy pound cake. Our customers tell us that it's better, and I mean better, than Starbucks. Yeah, our banana nut pound cake,
Of
our lemon pound cake,
course.
and our pound
Of
cake.
course. I'm a
That
butter
was
person.
amazing.
My favorite flavor is that doggone butter.
Hands down, hands down. So yes, you can definitely enjoy just perusing through our amazing 50 flavors of our pound cake. You can see that we've been on the news. We're vendors at the State Fair of Texas. We're also vendors at Grapevine Christmas. Grapevine is considered the Christmas capital of Texas. It is amazing. And this time, a pound cake in the pound cake world is where you want to be. You want to be here. Order it. Look, don't order flowers. Don't order edible arrangements. Don't send any of that stuff. Send whoever you love pound cakes. It will make life better for them. KendyK, thank you. It's been an amazing hour, 2 hours with you today. And I'm glad that you gave us the opportunity to talk knees, all things knee replacement. And making sure that you highlighted pound cake experts as well. We appreciate that.
We
We look
appreciate
forward.
you.
Yeah, we look forward to another conversation. I'm just excited to see what we're going to talk about next
Love
on your
it.
platform, because there's lots of things we grew up together. So there's lots of things that we
Mhm.
can put that sister spin on for you.
Hey.
Yeah, it's going to be really good. Thank you to all the viewers, everyone that has stayed with us and chatted it up for us and put those great comments out, asked those great questions to make us think and give people more knowledge and more information just about what they experience with new knees, because everybody doesn't necessarily know someone that's had a knee replacement. So this was a great time to learn and to become aware of what the knee replacement is all about.
Well, Sandy has said it all and really appreciate you. And it makes me think about a wonderful, let's do something special for KendyK's crew. And I do a prize wheel, and February is coming up next month. We've got Black History Month, and
Vicky, yes, yes, Vicky,
got
we will. We ship to the Midwest. Yes.
they ship all over the country. We've got Valentine's Day as well. So we'll make sure that we include as one of our January prizes. We'll do a special something in honor of poundcakeexperts.com. Y'all, we're getting ready to get down from this place. Thank you for joining us. This is KendyK
All
all day.
day.
Yeah, it's that time again, we shine again. From Memphis to the Northwest wind. It's love, it's life, it's every day. You can decay all day. Morning light, coffee in hand. Making moves with a master plan. Simple things make the spirit stay. We find our joy in the everyday.